Dr. David Wetherhold, internal medicine at Scripps Clinic. I went into internal medicine because it allows to have the whole approach to the patient care. I get to see my patients growing up. I have now been in practice long enough that I've seen my patients having kids, and now their kids are now my patients, and I'm seeing the whole evolution of the family and their patient care, and that's the main thing that I've really liked about internal medicine. Being in internal medicine, preventative care is extremely important. I consider it's one of the main things that I can do to help my patients. It is coming up with things that they don't even know may or could happen and preventing those before they do. And as an internist, that is the main philosophy that I will have, is take your current problems, take care of those, but also prevent the things that I can see may or will happen. That's what I do all day, is I listen. And maintaining eye contact with the patient is extremely important. I get to understand how important something is to you by listening, and also often will come to diagnoses just by listening and watching the patient, and I will know which direction to go. So listening is, being in internal medicine, listening is of A1 importance. In this day and age where there's so many medical tests that can be done, it is extremely important to have a primary care physician to help put it all together. I do have patients that come in and they want this test and that test, and often it goes into random directions and the diagnosis gets lost. I work closely with our specialist here, bring them in, bring all the tests that have been done, put it together, and then sit down with the patient and say, this is where we need to go. This is what the tests are showing.